Hey everyone, and thank you for clicking on this video. My name is Rachel, and I'm a registered nurse, a digital creator, and a mom. And today I am going to be sharing about why annual checkups matter, the importance of lab work, and preventative health tests, okay? So we're gonna jump right in. I'm gonna share my screen. I've got an awesome presentation for you guys today. All right, let's come on over here. And here we go. All right, so these are for men and women, particularly adults. So these aren't for kids. There's a specific list of pediatric, vaccinations and things like that. This is for adults, okay? So why should you care? I'm not sure what that answer is for you, but for me, my why is my son. My beautiful child is my inspiration and a daily reminder that health is wealth. I need to keep myself as healthy as possible so I can enjoy time with my son, who's depicted here, and be the best role model that I can be. So, I think this is something you hear all the time, health is wealth. But if you really stop to think about it, you can have all the money in the world, you can have all the possessions, but if you do not have your health, my son right now he's actually napping in the other room. He hasn't been feeling well. If you're not feeling well your entire life, there isn't the same level of enjoyment if you're sick and unwell. And obviously there's things that can't be prevented, but there's a lot that can. And that's what I'm going to be talking about in this presentation. All right, number one, blood pressure screening. Detects hypertension, which increases risk of heart disease and stroke. So how to keep your blood pressure in good range. You're going to focus on a whole foods diet. Limit sodium, avoid alcohol, smoking, processed foods. You're going to drink tons of water, half your weight in ounces. So if you're 200 pounds, you're going to drink 100 ounces a day. You want to get exercise every day, movement of some kind. It doesn't mean you have to go to a Pilates class, go to the gym, lift heavy, but aim to work out 30 to 45 minutes a day, whatever that means. Running with your dog, walking with your dog, doing some stretching, the more the better. Good sleep, reduce your stress. Easier said than done, but there's ways that you can do that, just like a quiet morning meditation, saying a prayer, focusing your mind, even just taking deep inhalations and exhalations can really relax you. If you are struggling with something with your job or a personal relationship, there's so much you can do with going to therapy, talking to a friend. Just focus on reducing one stressful thing a week and your overall general stress levels will be lower. And then having some sort of community. I increase this even though we're talking about blood pressure screening, having a sense of community and people that you can laugh with, that you can talk about issues that you're having. Like these are all stress reducing activities that affect directly your blood pressure. So when to get your blood pressure checked, every 1 to 2 years is the recommendation if you Google it. But I say yearly, like 2 years seems really crazy. Like so much can happen in a year, in 6 months, even in a month. So every time you go to your annual checkup, they're going to check your blood pressure. So just make sure you go to your annual checkups. Obviously, if you're having any kind of signs or symptoms, you want to go in and get checked. Next up, blood glucose test or your A1C. So this screens for prediabetes and diabetes. How to keep your blood glucose in good range. Whole foods diet. Avoid excess sugars, processed foods. Drink water. Exercise, good sleep, reduce stress. As you guys are going to see throughout this presentation, a lot of these things are the same preventative measures. And it's not another medication. It's not some secret pill. It's the basic pillars of health, which is good nutrition, exercise, sleep well, reduce your stress, drink water. But keep watching. Don't just stop watching now because I want to share all of these points with you guys. So testing for blood sugar is recommended every 3 years starting at age 35. I don't know if you knew that. I didn't before I researched this presentation. Earlier, if signs or symptoms are apparent or if you're overweight or have pre-existing reasons to get blood sugar tested. And the A1C is something that determines over a period of a couple of months. It looks at what your blood pressures are, and that gives them a number that can determine whether you have diabetes or not. So next up, a cholesterol panel or a lipid profile. So this assesses heart disease risk by measuring LDL, which is low density lipoprotein. This is what they call the bad cholesterol. So this is a combination of cholesterol and protein. And what LDL does is it transports cholesterol from your liver to your cells. When you have too much LDL in your bloodstream, it builds up in the arteries and it forms a plaque. We've all heard of this. That plaque narrows the vessel and it leads to heart disease, stroke, and other cardiovascular issues. You can imagine if you have a pipe that's this big and blood is rushing through it, you have really good blood flow and clearance. If that gets occluded because of plaques, you can imagine if the blood flow is just getting through this tiny little bit of blood flow, then it's not perfusing your body adequately because that is shrunk. So that's why you don't want to have that plaque build up inside of those pipes. So less than 100 milligrams per deciliter, that is the number that you want to keep below. So LDL is weird because LDL and HDL are two different components of cholesterol and people get confused by it. So that's why I'm reviewing this a little more in detail. So HDL is the high density lipoprotein or the good cholesterol. So having HDL, it actually removes excess cholesterol from the arteries and then it transports it to the liver for processing and elimination. Normal levels are 40 milligrams per deciliter for men and 50 milligrams per deciliter for women. So low levels of HDL actually increase your risk for heart disease. So with LDL, you want to have it be high and the opposite. Low levels of HDL increase your risk. So you want to have a higher HDL number and a lower LDL. So how I remember it is LDL is loser or low, and then HDL is the opposite. Recommended testing every 4 to 6 years, starting at age 20, again, more frequently if you are at risk. How to keep cholesterol in a good range: exercise, healthy diet, stop smoking. That's definitely, as my son would say, X. Genetics and medications also affect cholesterol levels as well. So keep that in mind. Number 4 is body mass index or BMI. We've all heard of this. And then measurements. Measurements are very important as well. You can get on a scale. A scale doesn't tell the whole story, right? That's weighing just like your entire body. But doing a circumference measurement around your abdomen is really important to do. So what does BMI and measurement do? This monitors obesity and associated health risks. So excess visceral fat in the midsection of your body increases your risk of heart disease and stroke, diabetes, number 2, type 2 diabetes, certain cancers. And having this visceral fat in your midsection can actually double your risk of dying prematurely. So you want to keep your midsection less than 40 inches if you're a man and less than 35 inches if you're a woman. And when do you do this? When do you get your BMI assessed and when do you do your measurements? At routine checkups. I would actually recommend you do this more frequently, but the recommendation, if you were to Google it, is yearly. Number 5, colorectal cancer screening. This is a huge one, you guys. So what does this include? A colonoscopy, which examines the entire colon from rectum to cecum. This requires more of an extensive bowel prep. There's also stool tests and a sigmoidoscopy. The sigmoidoscopy examines only the lower part of the large intestine or the colon. Signs and symptoms to watch out for. Why might you need to go have a colonoscopy? Well, if you have changes in bowel habits, if you're feeling the need to have a bowel movement that's not actually relieved by having one, if you have any rectal bleeding with bright red blood, any blood in your stool, unusual weakness or fatigue, consistent abdominal pain, bloating, cramping, or unexplained weight loss. These would all be signs and symptoms to watch out for. When do you start thinking about doing this if you don't have signs and symptoms? Age 45, repeat every 10 years for a colonoscopy or as advised. How to keep your colon healthy, because we want to prevent this stuff, right? Exercise, a diet that's high in fiber, stay hydrated, especially if you're increasing your fiber. If you're taking any kind of fiber supplement, you need to stay hydrated. Exercise, and then limit processed food, alcohols, and excess sugars. Skin cancer screening. So this is number 6. So checks for unusual moles or lesions. So to lower your risk is avoid tanning beds and always wear sunscreen with UVA and UVB protection with an SPF rating of at least 30. Recommended you do self-checks monthly and examination by a clinic if concerns arise. Number 7, get your immunization. So flu, Tdap, COVID, pneumonia, shingles, MMR, hepatitis B, hepatitis A. Helps prevent infections that can lead to serious illness. So follow your provider's immunization guidelines for your age. And if you're traveling overseas, certain regions of the world, you need to follow those guidelines as well, because there's different vaccinations that you need to get prior to going to certain countries. All right, so these are tests that are just for the ladies. Pap smear and HPV test, very, very, very important. I cannot stress this enough. Screens for cervical cancer. Cervical cancer is primarily caused by the human papillomavirus, or HPV. We've all heard of this at this point. They're vaccinating kids in junior high. They didn't have that vaccine when I was in junior high. Did you know smoking actually increases your risk of developing cervical cancer, and it actually makes it more aggressive if you're a smoker? When is it recommended to do a PAP? You should do your first when you're sexually active, and then every 3 years unless otherwise indicated until the age of 29. And you should do a PAP and an HPV test every 5 years between the ages of 30 to 65. Next up is a mammogram. So this obviously screens for breast cancer. Signs and symptoms to watch out for would be a new lump or any kind of thickening in the breast or armpit, changes in the breast size or shape, dimpling or puckering of the skin, nipple discharge or changes, redness or warmth, swollen lymph nodes under arms or near your collarbones. And this is recommended every 1 to 2 years starting at age 40 or depending on other risk factors. The third test for females specifically is the bone density scan, or the DEXA scan. So this is checking for osteoporosis, and what it does is it measures bone strength and it uses a small amount of radiation to do that. Risk factors that are non-modifiable, so those are things that you can't actually change. Age, so after menopause you're more prone to developing this. Women, white and Asian race are actually more prone to developing osteoporosis than other races. If you have a parent or sibling who has osteoporosis, that increases your risk. And if you're a thin or petite female, that means you actually have less bone mass to lose. So you're starting out with little, and the risk of developing osteoporosis, it increases your risk if you're already petite to begin with. Some modifiable risk factors. These are things that can change, that you can change. So hormonal stuff. You can do hormone replacement therapies. A lack of physical activity. So what that does is that actually weakens your bones. Poor diet. So if you have an insufficient calcium and vitamin D intake, that's going to weaken your bones. Smoking, which actually damages the bone cells themselves and increases your risk of fractures. Excessive alcohol consumption. So this interferes with bone metabolism. And then certain conditions like rheumatoid arthritis, hyperthyroidism, and eating disorders can all contribute to developing osteoporosis. So when should you get a bone density test or a DEXA scan? Starting at age 65 or earlier if you have other risk factors. All right, now these are 3 tests just for the men. So prostate-specific antigen, or PSA, this screens for prostate cancer. There is no exact cause that they can identify that specifically triggers prostate cancer. However, they know that genetic mutations in prostate cells is a big contributing factor. So what also increases the risk? If you're over the age of 50, if you're a black male, if your father or brother has prostate cancer, it increases your risk. If you're obese, it actually increases the risk of an aggressive and advanced case if you are obese. A diet high in processed meat, saturated fats, smoking cigarettes, excessive alcohol consumption, exposure to certain chemicals. So if you're working in like a manufacturing plant, that can increase your risk of getting prostate cancer, and chronic inflammation due to frequent infections. So when do you get a test for a PSA? Discuss it with your doctor, but starting at age 50. If you have any of these other risk factors, you should do it sooner. Number 2 is an abdominal aortic aneurysm, so an AAA test. So what is an aortic aneurysm, an abdominal aortic aneurysm? So basically it occurs when the aorta, which is depicted in this image, which is the main artery, the body's main artery. It's like a water hose. So an aortic aneurysm is when a portion of this bulges out or balloons in the abdominal area due to weakened walls of the aorta, which could lead to a rupture and internal bleeding. So how do they test for it? Well, they do a non-invasive ultrasound scan, and that will actually check for the abnormal bulge in the aorta, and they can identify it. This can be a very slow, gradual weakening and a slow bulge. So someone may not have a lot of symptoms, but signs and symptoms to watch out for an impending rupture are throbbing, deep back or side pain that develops suddenly or lasts a few days, a steady gnawing abdominal pain that lasts for hours or days, a pulsating sensation near the belly button, and shortness of breath or feeling faint. So when is this test recommended? It's for men aged 65 through 75 who have ever smoked cigarettes. Even if you quit smoking when you're 40, if you're 65, you still should get tested for an abdominal aortic aneurysm and your risk for that. And the last test for men is testicular exam. So this screens for testicular cancer. And how to do it. So you're gently going to roll each testicle between the thumb and fingers to feel for any lumps, bumps, or changes in size or firmness. The ideal time to do this is after a shower or bath when the skin is relaxed, because if it's shrunk up, you can't really feel if there's any changes. So you want to make sure everything is nice and relaxed, and that way you can make sure that there's no lumps or bumps. So this is recommended to do a self-exam. And then clinical checks whenever needed. So you can do that, once a month, just as part of your routine that you incorporate. So here are some preventative labs for adults. So these are things that I recommend you get done yearly. A comprehensive or complete blood count, or a CBC. So what that checks for is anemia and other infections and overall blood health. A comprehensive metabolic panel, or a CMP, that evaluates liver and kidney functions, and then blood sugar levels and electrolyte balance. Vitamin D, so that, sorry about that. Vitamin D, low levels of vitamin D are very common, and they can affect bone health, immunity, and your mood. Vitamin B12 is very important for nerve function and energy. And then checking for inflammatory markers. So CRP or HSCRP, if you have elevated levels, that can signal chronic inflammation, which is linked to heart disease and other conditions. And then we have the iron panel, or ferritin, which screens obviously for an iron deficiency or an overload. And iron levels are really important for energy, especially for females. And then we have a sex hormone panel. So that's estrogen, testosterone, DHEA. If you are chronically fatigued, you have mood swings, low libido, anything like that, you should definitely get a blood test, sex hormone panel to check out those levels. Cortisol levels. If you're feeling chronically stressed or fatigued, get your cortisol levels checked. And then a urinalysis. This isn't a blood test, but it's a lab. So checks for kidney function, other infections, and then metabolic markers. All right, so that is the end of my presentation. I'm going to pop back to here, stop sharing. All right, so I hope you guys enjoyed this video. If you enjoy these preventative tips, let me know in the comments below. Like and subscribe, and I'll see you on the next one. Have a great day.